everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss MCQs. And then, who all have visited on first time on this channel, please do subscribe. To see the first question, the bacterial gene transfer mechanism involving direct cell-to-cell contact is called. Here are the options. Right option is C, that is conjugation. What type of virus contains a segmented RNA genome and can undergo antigenic shift? Orthomyxovirus. Which of the following antibiotics targets the bacterial cell wall synthesis? Right option is penicillin. The primary immune response is characterized by right option is B, that is formation of IgM following by IgG. What enzyme is essential for reverse transcription in retroviruses? Right option is C, that is reverse transcriptase. Which staining technique is used to identify Mycobacterium tuberculosis? Acid-fast stain. The bacterial endoscope is primarily important for right option is C, that is survival under harsh condition. What is the role of ribosomes in bacterial cells? Protein synthesis. What type of immunity is provided by antibodies transferred from mother to fetus? Right option is B, that is natural passive immunity. The quelling reaction, that is quelling is nothing but a swelling. The quelling reaction is used to identify capsule of bacteria. Which of the following fungi is an opportunistic pathogen commonly causing oral thrush in immunocompromised patients? Right option is B, that is Candida albicans. Next question. Endotoxins are chemically composed mainly of right option is lipopolysaccharides. The microbial growth phase where the population increases exponentially is right option is log phase. Next question. What structure allows viruses to attach and enter specific host cells? Right option is B, that is envelope proteins or spikes. Who was the first person to observe microorganisms using a microscope? Right option is B, that is Antony van Leeuwenhoek. How long after death does rigor mortis typically begin? Right option is B, that is 2 to 4 hours. At what stage of rigor mortis is the body most rigid and stiff? Right option is B, that is peak stage. Next question. What happens to rigor mortis after it reaches its peak? Right option is B, that is it resolves and the body becomes flexible again. Next question. Which of the following factors can influence the onset and duration of rigor mortis? Options are here. Right option is ambient temperature. Next question. When preparing a diseased body, what is the recommended method for handling the body during the rigor mortis stage? Right option is B, that is avoid manipulating the body excessively. Next question. The Panchayat Raj consists of 3 tier structures. Options are given. Right option is B, that is Panchayat, Panchayat Samiti and Jila Parishad. Next question, ICDS does not cover. That is formal education. Red Cross Society was founded by. Right option is B, that is Henry Dont. Which of the following is known as heart of ICDS system? That is Anganawadi. ICDS, that is Anganawadi. Next question. Guidelines for baby-friendly hospital initiative includes following except. Right option is B, that is mother to initiate breastfeeding in 4 hours normal delivery. Next question. The Children's Act was passed in the year. Right option is A, that is 1960. Next question. In India, the ESI Act was enacted in the year. That is right option is B, that is 1948. Next question. One eye surgeon is recommended for. Right option is D, that is 5 CHC. Next question. Number of ASHA visits after home delivery is. Options are here. Right option is D. Please like, share and subscribe to my YouTube channel for more informative topics. Thank you for watching.